Are you trying to figure out the difference between home care and home health care? If you are confused, you are not alone. Most people assume these two terms mean the same thing, but they don't. I've been a senior care consultant for many years, and in this short video, I will help you clearly understand the difference in services, what you can expect, and discover the average amount paid per hour for the help you or your loved one needs. First, the term home care means non-medical services. These services are not provided by nurses. Home care includes things like this: personal care, such as help with bathing, dressing, showering, toileting, or continence care; assistance just getting around the house; most importantly, medication reminders to keep people on their meds on the right schedule; and cooking, laundry, and light housekeeping. Home care companies also can help with shopping, errands, and incidental transportation like doctor's appointments or just going to the grocery store. Home care services can be absolutely critical in allowing someone to maintain their independence for as long as possible. Their help may be temporary, such as after a surgery or an illness that does not really require skilled care. You do not need a physician's order for home care, and it is not paid for by Medicare. Expect to pay out of pocket unless you have a long-term care insurance policy that covers some of the costs. In 2021, the average cost of a home care aide was between $20 and $25 per hour, but costs can vary considerably from state to state. Most companies have a required minimum of 3 hours a day, and some require a commitment of 20 hours a week before they will even accept the job. Now, let's talk about home health care companies. Home health care companies are considered medical because a physician's referral is required, and the employees are typically licensed nurses and therapists. Professional home health care services include things like wound care or incision care after any kind of surgery or injury. It includes medication, supervision, and education. A big part is pain management, and also disease education and management. And probably most well known is the physical therapist, the speech therapist, the occupational therapist that can assist after surgery. Most patients returning home after a stay in the hospital for surgery or fall can expect a doctor to order home health care services for at least several weeks after you leave the hospital. This kind of care is critical for a full recovery, and it helps the care team monitor how well a patient is doing after a serious health event. Make sure to ask the doctor and the discharge planner at the hospital when these services will start, but I advise lining them up before you even leave the hospital. Most of these costs are covered by Medicare and your supplemental policy, but they are limited by time or number of visits. They won't continue forever. Expect to pay about $75 to $95 an hour, with higher rates for weekends or nights once Medicare or your insurance policy stops paying. As a certified aging life care specialist, I have helped hundreds of families choose exactly the right care for every situation, and I can help you too. I know the right questions to ask about staffing, licensing, costs, and contracts, and I know how to tell who will provide just enough of the right kind of care. If you are looking for safety, quality of life, and peace of mind, let's talk. I'd be happy to help you. Just click on the link below and let's find a time that works for you.